Welcome to Frederick at its best. I'm Frederick County Executive Jan Gardner. September is National Ovarian Cancer Month, and we are going to do our part in Frederick County to step up awareness by holding today's special ceremony. And one of the key messages from today is that ovarian cancer is more than a woman's disease because it affects everyone in a woman's life. Early detection is critical, and we want to bring attention to some of the early warning signs. In women ages 35 to 74, ovarian cancer is the fifth leading cause of cancer-related death and the deadliest of all gynecological cancers. It can strike at any age, and it's estimated that 1 in 75 women will develop ovarian cancer during her lifetime. The American Cancer Society estimates that there will be over 22,000 new cases of ovarian cancer diagnosed this year, and that more than 14,000 women will die from this cancer. When a woman is diagnosed and treated in the earliest stages, the 5-year survival rate is over 90%. But if cases are diagnosed in later stages, the prognosis is poor. If caught at stage 3 or higher, the survival rate can be as low as 28%. So the sooner ovarian cancer is found and treated, the better a chance for long-term survival. In most cases, ovarian cancer is not detected during routine pelvic exams unless the doctor notes that there is an ovary that is enlarged. And a pap smear is not a way to detect ovarian cancer. Of course, we still want everybody to get their pap smears too. The key is early detection and knowing some of the signs and symptoms. So health providers have come up with an acronym that describes the symptoms, and it's called BEAT. And BEAT stands for bloating, eating and feeling full, abdominal pain, and trouble with urination. And I'll repeat those. It's BEAT, bloating, eating and feeling full, abdominal pain, and trouble with urination. And of course, most of us know that we can have at least some of those symptoms at other times as well. The medical community simply doesn't know enough to effectively detect the disease in its early stages. So the best defense against ovarian cancer is to talk to your doctor, and talk to your doctor about your family history, and even consider genetic testing to understand your odds. It's important for all women to listen to their bodies and to watch for early symptoms that may be present. And to learn more, you can go on the webpage and visit cancer.org/ovarian. There's a national group that's helping to raise awareness about ovarian cancer, and it's called the National Ovarian Cancer Coalition. And this group has been in existence since 1995. Throughout the year, the coalition has a program called Take Early Action and Live. It's known as TEAL, and you'll note that a number of people up here are wearing teal. TEAL teaches the public about the signs, symptoms, and risk factors of ovarian cancer. It stresses that women should take action, not chances. The coalition also encourages early conversation with doctors, and I'm proud to say that we do have a local chapter here in Frederick County that serves our Frederick County community in the surrounding area. And it was started by Kathy Duncan, who is with us today, and she was diagnosed with ovarian cancer in 2012. So we'll hear from Kathy shortly. The chapter focuses on providing support for newly diagnosed women and for women at all stages of the disease. They also have fundraising events because certainly supporting research and the ultimate cure is part of the goal. Their biggest event is a 5K walk to break the silence on ovarian cancer, which is held the third Saturday in June. Last year they had over 500 participants and raised over $82,000 for education and research for the cure. In addition to these organizations, I'd like to make a special note about the Frederick County Community Cancer Coalition, which is coordinated by the Frederick County Health Department. Coalition members come together with representing many different organizations and the faith community. The purpose of the coalition is also to heighten public awareness and the need for making sure that everyone gets timely and routine screenings. Public and private healthcare partners work together to develop a comprehensive plan for cancer prevention, education, screening, and treatment. So before I read the proclamation, I'd like to ask my guests to introduce themselves and to share whatever information they would like to share, and I'd like to start with Kathy.
Good morning. My name is Kathy Duncan, and I am the co-chair of the NOCC Frederick chapter. I began this chapter after I was diagnosed with ovarian cancer in 2012, and I just really felt that there was the need for more awareness. For 7 months, I had the classic symptoms of ovarian cancer. I had the bloating, I had the eating and feeling full, I had abdominal pain, and I also had trouble with urination, yet it went undetected for a long time, and therefore I ended up with late-stage ovarian cancer. And it's critical that we diagnose and know the symptoms of this disease early so that no other woman has to hear the words, "You have ovarian cancer." And I encourage anyone that's interested in this subject to contact us at ovarian.org, or also to contact me directly through the Frederick chapter.
I'm Deborah Subcariu, and I'm also the co-chair of the Frederick Walk, although hats off to Kathy, who started it, and I joined in. I'm a ovarian cancer survivor. I was of 3 years. I was diagnosed in October 2013, and I can honestly say I knew nothing about ovarian cancer until I woke up in the recovery room learning that I had that after a routine ovarian cyst surgery. So all I can say is the symptoms can be quite vague. We're women. We are often the ones running the household, and we tend to ignore our symptoms. They are very similar to the symptoms we get every month. And I just encourage women to know your bodies. Don't be afraid to push your doctors. Don't be afraid to seek help. I, too, like Kathy, was diagnosed at a late stage. And although there's a lot of statistics stating that it's a 90% survival if diagnosed early, it's important to know that very, very few cases are diagnosed early.
Thank you, both of you. I'm Carol Jordan, and I actually drove up from Montgomery County today. Thank you for having this group in Frederick County. I was diagnosed in 2011, so I'm a 5.5-year survivor. And I actually know people that are 16 and 25-year survivors, so that's a good thing for all of us to have hope. And what you both said before me, it's important to say to your doctor, could this be ovarian cancer, because the symptoms are so vague? And some of the things that we need to know is that researchers generally don't want to study ovarian cancer because it does have such a poor prognosis, and it's also diagnosed in late stage. So it's not something that they're clamoring to study. So some of the treatments are the same that have been around for 30 and 40 years. So I think there's some hope on the horizon. Some of the latest literature has actually said women, for the next generation of women who take oral contraceptives, can actually have a protective effect, and it can actually cut the risk of ovarian cancer by 50%. So there is hope on the horizon for the future generation and for us standing up here. Thank you.
Hi, I'm Frank Blanchard. I'm with the Frederick National Laboratory for Cancer Research here in Frederick, and we have a staff of about 2,000 people who are working to understand the basic biology of ovarian cancer and other cancers, with the hopes of developing new treatments and better ways of detecting the cancer at its earliest possible stages. So we are making progress. We hope to make progress more rapidly, but we are making progress.
Hi, I'm Ellen Windmiller. I'm a 2-year survivor of ovarian cancer. However, I am at stage 4 at this point. My ovarian cancer has moved to my lungs, and I am being treated for that, but only at this point it's being kept at bay. They're not offering me a cure. And my hope is that one day there will be a cure, that they're not just saying, let's just see how long we can keep it from coming back, but let's see if we can get rid of it. That's my hope.
Good morning, everyone. I'm Beth Mowry. I work at the Frederick County Health Department cancer screening programs, and also sit on the local cancer coalition, and just very pleased to be here this morning to support this local chapter. Thank you.
Hi, I'm Avnisha. I work at Frederick County Health Department as community health educator, and I'm very pleased to be here.
I'm Brenda Broadbent. I live near Mount St. Mary's in the northern end of the county, and I had symptoms probably last January that weren't, the dots weren't connected until I showed up after denying that something was wrong at the end of April, and got a diagnosis the very next day, which was quite a bit of shock and awe, followed by surgery, major surgery, about 8 days later. So I wish every GP understood what these simple symptoms looked like and would be more suspicious. My life is consumed at this point by treatment until the end of the year, and I am only speaking to you lucidly because I'm on a 1-week chemo vacation because of a side effect. So I hope that no one else has to do this. Thank you for the research.
Hi, my name is Kathy Vega, and I'm a 2-year survivor of ovarian cancer. I was diagnosed in 2014. My 2 symptoms were vague and all the classic symptoms, and I went to my primary care, and they listened. And I was diagnosed early, and I feel really blessed with that because a lot of my sisters are not. I feel this disease has given me a responsibility to talk about, share awareness. As a mother, a daughter, a sister, we have to make this awareness to the public. And I don't want to say I'm happy to be part of this group, but I am happy to be part of this group.
Really, I want to thank you all for participating in this and for being part of this awareness. You know, your stories really matter to the people who are watching this, and I really appreciate you having the capability and the bravery to come in here and speak. It really does help to add the real life impact of ovarian cancer. So I do want to read the proclamation I have. Whereas ovarian cancer causes more deaths than any other female reproductive system cancer and affects women of all ages and backgrounds, where in every September, in honor of the women who have suffered from ovarian cancer and the brave individuals who are still fighting this disease, we reaffirm our commitment to reaching for prevention, treatment, and a cure. And whereas it is estimated that more than 22,000 American women will be diagnosed with ovarian cancer this year, and often because of lack of effective screening and early warning signs, many of these cancers will be caught at an advanced stage. Whereas the National Ovarian Cancer Coalition, the Center for Disease Control and Prevention, the Frederick County Health Department, and other organizations have strived to raise awareness of gynecological cancers, including ovarian cancer, and to encourage women to learn of the warning signs and to seek medical care. And whereas for the mothers, sisters, daughters, and families who face the pain and heartache of ovarian cancer, we must make America the country that cures cancer once and for all. During National Ovarian Cancer Awareness Month, as we recognize those in the medical community who work tirelessly to provide treatment and care, and as we pay tribute to those who have lost their lives, and as we express gratefulness to the people who come and share their stories, let us resolve to increase awareness of ovarian cancer. So now, therefore, as the County Executive of Frederick County, Maryland, I hereby proclaim the month of September 2016 as Ovarian Cancer Awareness Month in Frederick County and commend this observance to all of our citizens. And I will say, for all of the women who are watching this, I think the best way that you can help to increase awareness is to really share the symptoms, the BEAT symptoms: bloating, eating and feeling full, abdominal pain, and trouble with urination. And, you know, women are very busy. We have to be our own best advocates if we have symptoms, and really to get the help that we need for our own health and for the health of our families. So thank you for joining us today, and please get the word out. If you are someone with ovarian cancer, we do want to connect you to the organizations that exist in our community, because we want to increase that survival rate, and we want to make sure that, and let people know there's really people right here in Frederick County who are working on the research for the cure for cancer. So thank you for joining us.